and welcome in today. I'm Earl Owens, joined by Tira Barrett, whom is with the CDC Public Health Associate. Also, Miss Christy Green is the Director of the Cumberland Valley District Health Department, which consists of Clay County, Jackson County, and Rockcastle County. And we are with you today, among other things, to really discuss the pandemic that has affected basically all of us, not only in our nice nestled region, but worldwide, named COVID-19 or the coronavirus. And ladies, I tell you, frontline workers, and I know from personal experience of being with you all, it has been a daunting task for the nurses, for public health, for hospitals, clinics, for everyone that's been involved. And you know, we do talk about true heroes, and I want to say that shouldn't be taken lightly, because we have had a lot of folks that have been putting themselves in harm's way to keep even more people hopefully safer. So, coronavirus, where did we come from? How long has COVID-19 been around?
All right, well, we first became aware of COVID-19 in the United States in February, although antibody testing and research as this pandemic has unfolded, leads us to believe that it was likely here a little bit earlier than that. They've linked some cases back into the January timeframe in certain cities. But for us here in Cumberland Valley District, our first cases started appearing in March in Rockcastle County, and then soon after in Jackson County. And we managed to make it up into May.
Yes.
In Clay County before we had any cases. So we thought for a little while we might be doing something right, and I do think we were being pretty careful and trying to follow the social distancing rules, but unfortunately it has visited our community here as well, and we are rolling with the outcome of that, I guess, or the repercussions of that. So we've been in this now for more or less 6 months in our region and in Kentucky, and we anticipate that this is going to continue through the fall and winter. Can't say for certain what to expect, but what we know from other viruses that behave in similar ways to coronavirus, we should expect to see this continue through 2020 and likely into the early spring 2021.
So Tira came with us, to us from CDC, and her initial job was to help out in a very important program, harm reduction. We kind of talked about this too. I recently had no idea that a pandemic was going to break out.
Yes.
Recently it's been stated, and I know Christy was on some Lexington news media and Hazard talking about hotspot of Clay County, and technically Clay County isn't a hotspot right now with COVID-19, right?
So right now, due to the way that the state calculates our numbers, we are being skewed as a red zone. However, that is mostly due to the current outbreak at Manchester Federal Correction Institution. So what we're seeing there that's kind of skewing our numbers is that big outbreak in that facility. But community spread, we're kind of not seeing that same dramatic red zone that we're being categorized as.
The district-wide, currently, the cases that we have, how many, I guess, cases that we have right now, and how many have we had? We'll start in Rockcastle County first. I know, kind of mentioned that was the first place, Christy, that we actually saw the coronavirus start creeping in. So total cases maybe going on now with Rockcastle County.
Okay, so I'll start with kind of our total district cases, if that's okay. So as of yesterday, we had 452 total cases in our district, in Jackson, Rockcastle, and Clay County. We have 100 confirmed cases in Rockcastle County, 191 confirmed cases in Clay County, and to clarify there, roughly 75 of those are associated with Manchester FCI. So if you kind of back that out, we have about 120, 125 cases in Clay County that are associated with the community rather than with the prison facility. And then in Jackson County, we have 161 cases confirmed as of this date.
You know, we talk about what can we do to help spread and help this from spreading, and you know, social distancing. We've had guidelines that we've been a part of with restaurants and other venues. Hand washing, Tira, that's always important. Sing happy birthday as you wash your hands. I mean, that was what we were taught at an early age.
Yes.
You know, in my kindergarten class, I can remember my teacher lining all of us up before lunch or before recess or after recess, and we would sing happy birthday and scrub our hands between your fingers, fingernails, and wrists. But that's one way. And of course, the masking is the other.
Yes, you know, we don't know much about this virus, but what we do know is that good hand washing for at least 20 seconds so you can sing happy birthday, your ABCs. I'm from Georgia, so I'm a little bit more biased towards Outcast while I'm washing my hands. But make sure it's 20 seconds to get really good in between those fingers, those hard to spot areas. And that really helps to kill viruses because it's not just washing them off, you're physically breaking them apart. Also, that social distancing, making sure you're 6 feet away. You know, we know that this virus can carry, and if we have enough space between us, we're making sure that that virus doesn't land on us. But most importantly is having some sort of face covering. You know, what we know is that something covering both your mouth and your nose is better than nothing. So whether it's a garter, a bandana, one of these cloth masks, just something that covers your mouth and your nose helps to protect your loved ones in our community.
And there's several different forms, Christy, of masks available. I know that, as Tara mentioned, something is better than nothing. But there are actually better masks that are available, I think, in the medical community. A lot of them wear the N95 or larger than the face shields too. We even had some local folks, I think Phillips Diversified, that produced a lot of face shields for people to wear.
Yes, and Phillips Diversified donated at least their first batch of those to healthcare providers in Clay County and Jackson County. So they provided us with a couple dozen face shields to add to our stock that we were using here. I'm going to kind of segue there into the masking and the PPE. So as part of what we call public health preparedness, we've been practicing and training for years for how to respond to just such an epidemic or pandemic in our populations locally. So that's not something the public would see very much of because we tend to practice kind of behind the scenes. But we also have maintained as part of that preparedness program stockpiles of PPE, including masks and face shields and goggles and gloves. So during the very beginnings of this pandemic in the Kentucky regions, we were able to share that stockpile with the healthcare providers that were testing. And that was very helpful, I think, as people scrambled to try to find mask and face shield supplies, especially the N95s. They became very hard to get a hold of. And I just want to shout out and put a thanks out there to all of the different industries and businesses that have retooled quickly to try and produce things like face shields. We've got some local businesses that are selling and making and selling their own cloth masks, lots of different things like that where people have bubbled up to be helpers in the community, and I wanted to be sure and acknowledge that. And I'm not going to try to name names because I would be sure to forget someone or leave someone out, but we're just very grateful for that because, as Tara said, we don't have a treatment or a preventative, so we don't have anything to cure this disease yet, and we don't have a vaccine to help prevent it yet. So it's critically important to practice the hand washing, the social distancing, and the masking. So I'm really grateful for all the different places that have helped provide those supplies in our community.
In our region now, we have several testing sites that are set up, and I know there's a couple of different tests out there that you can get for the COVID-19, but maybe which one is the best? If someone's thinking that you may have been exposed, you want to go get a test, and probably I would think the swab would certainly maybe have the most accuracy to confirming or denying the virus.
Are you passing to me?
Yeah. I'll let you go.
Okay, so I want to, before I say anything about the test, I want to say that what we know, what science knows about the tests and the most effective ones is still evolving. So what I say today is kind of our best knowledge to date, but I do know there are other, there's research and experimentation in the works for more saliva-based testing and more rapid testing to try and help us, get results faster. So this will change. But as of right now, what we prefer to recommend if someone is thinking about testing or needs to be tested is what we call the PCR, or the polymerase chain reaction test, and that's the nasopharyngeal swab that they go back and tickle our brain. Some people say it tickles. I don't know that it tickled when I had to pat my foot. That hurts so bad. But that test, it takes a little longer to get the result. It's not going to be a rapid test like some facilities are offering, where you might get your results in 20 minutes to 3 hours. But we are finding that overall the PCR test is the most reliable. We have less false positives, but more importantly, we have significantly fewer false negatives. And that's a concern to me, because if someone gets a false negative, then they think they're okay, and they continue to move around. And we've actually had anecdotal experience with this locally, where people get one result and it's negative, they think they're okay, and then unfortunately maybe they develop a few symptoms, test again and find that, oh, they are actually positive. So for recommendation, it takes a little longer to get the result, and we ask that people isolate as if they were positive until they get that result, but we prefer the PCR, the nasal swab.
And that brings us, I guess, kind of to the next topic. We now have contact tracing going on, and we all know that this is totally different. In our generation, we've had the swine flu, we had what we call bird flu to come in, but nothing as impactful that this is. And some people may think, well, I can't tell you everyone, but that's not the way to do it. And it's not an invasion of privacy. This is to keep the people you love and other people healthy. If a contract tracer knows who you've been in contact with or where you've been, it's not anything that is an invasion of privacy. It's for everyone's health.
Yeah, most definitely. I think, a lot of times, I know myself, I like being a private person, I don't like everyone knowing my business, but I think a big thing about contact tracing is that we want to make sure that our community and our families stay safe. And if we get a better idea of where this virus is spreading, we have a better idea of how we can prevent it from spreading to the most vulnerable in our population. So those that are part of the elderly group, those who have multiple diseases that weaken their immune system. This is really just a way so that we can protect our own. And one thing I really want to push is that our nurses have been on the front lines since we got our first case on March 30th. And they're really here. They've been basically in overdrive. And so I just want to plead that when you have a nurse on the phone with you, they're really just there to make sure that you are in good health and that they can protect our community. So please just be friendly and courteous with our nurses. They've really been, the heroic part of our staff since the very beginning.
I'd like to second that. Since March 30th, each of our counties, the nurses that work there, and we have between 2 and 3 nurses in each county, have had their stints where, with small clusters bubbling up, or with the outbreak at Jackson Manor Nursing Home, for example, where they've worked 7 days straight for more than a couple of weeks at a time, because it's so important for us to document the cases, work with the people who are positive to make sure that they're getting the care they need if they need it, also to do the contact tracing, and that it takes time, but it's worth every minute of it. So they really have worked. We get a break every now and then from one county to the other, and we take a little breather, and then we try to help the other counties. So it's just been very busy. And I would like to also elaborate on the importance of telling the nurse or the contact tracer, if they call you, really being open about where you've been. And I'm going to give a couple of examples. So we had an exposure at an event, and there were several people who attended that event that tested positive. However, they were concerned about maybe confidentiality, or about causing people to be quarantined and maybe losing some wages, various concerns, and they did not disclose to us the event or all of the people who had been at the event. So the end result of that was we had over 30 people test positive, and we had 2 deaths. Now, I'll give another example of an event in the same community where the people that tested positive were very concerned about everyone at their event. And so they wrote us out a list of everyone that had been there. And from that event, we had less than 10 total positive cases, and the spread stopped at the households that had participated in that event. So that's why it's so important to share with us where you've been and who you've been around. Not so we can do something retaliatory or harmful, but so that we can kind of, like you might do with a grass fire, when one flames up, you're going to need to stomp that out, tamp that out. And that feels like a good analogy for me of what we try to do with contact tracing. We try to, when cases flare up, we try to identify all the possible exposures, ask people to quarantine and isolate, and we slow that spread down. And so while for many people they don't have a lot of symptoms, we also know that for others they become very sick, and it's even fatal. So the ability to slow that spread helps us reduce that risk for our community overall.
Of course, daily updates are provided on the district's website. Also on Facebook, there's several means of getting the word out to the public that this agency uses, and there's all kinds of tips anytime anyone has any questions. Most likely you can log on. The links are provided. You can get all the information that you need concerning the COVID-19.
Exactly. I also just want to point out several federal websites, just because, everything is changing, day by day, hour by hour, minute by minute even. So definitely want to point out, as on the CDC website, cdc.gov/coronavirus, but also the White House website, coronavirus.gov. These websites have been really helpful, showing frequently asked questions, tips to keep you and your family safe, and any additional questions you have about coronavirus.
And of course, at the end of the day, we want to keep people healthy. We want to keep people safe. Having said that, kind of a quick hitter here as we begin to wind down the show today. The census. It's something that you've heard about, you've gotten emails, you've gotten the paper delivered to your home. It's simple to do. You can log on, and all they have to do is give the participants in a household. And people say, well, why is this important? I'm not fooling with that. But the thing is, and at issue here, it affects us all. Federal funding, tax dollars that comes back to your community is all population based. Not only for the educational system, your city and county governments, but also agencies as the Cumberland Valley District Health Department. And this health department helps out in so many ways for our communities. And in the future, we'll bring you more of the programs that we do, but it's so important that people take care of your census. You gotta get those in.
Yes, yes, absolutely. Just a quick example of how population estimates impact funding. People may have heard speculation that our federal funding or state funding for COVID response is tied to our number of cases, and that is not the case. It's actually tied to our population numbers. So when we received our first chunk of funding to help offset the costs that we had accrued here locally, that was based per capita or per head. So our funding reflected roughly 20,000 people in Clay County, roughly 13,000 in Jackson County, and roughly 17,000 in Rockcastle County. Those funding mechanisms typically are based on chunks of population. So completing that census helps benefit our schools, our health departments, our county road system, the funding we have for that, and also things that are a little more ancillary, like, for example, Volunteers of America and Freedom House. When they apply for grant funding, federal funding or private foundation funding, they have to provide data showing the percentage of population affected by substance use disorder. So having good, accurate population information helps us give a better picture of the health or societal issues that we're working with in our community. So definitely tied to a lot of funding for a lot of different services that you may not even think of.
So certainly fill those out. And I know that census workers will be knocking upon some doors as the weeks progress here. So kind of keep that in mind. They will be identifiable. I mean, it's like everything else. Sad to say, but some people may try to take advantage of folks, but they will be identifiable as census workers if they come to your place. So kind of keep that in mind. But the easiest thing to do is just do it online.
Yes.
2 or 3 minutes, you're done.
Yeah, I completed it online. When I got the mail, the little envelope in the mail, and I was done in like 5 minutes. And this is basically a once in a 10-year chance to do this. You can't just push it off because you can't fix it until 2030. So definitely take the time to fill it out.
And Earl, are we at less than 40% completion in Clay County? Is that correct?
I think the last thing I saw, the number was 43% completion.
Okay, so we're going up.
Yeah, but
we
still
want
not
more
good.
than that. Yeah.
I mean, we want 100%, if there is such a thing, We have to get that, just like we say. I mean, it's so important for everything we do and the services that are provided. If you want to see those services continuing here, we have to fill out our census.
Yes, and if people have any questions about how to do that or where to go online to fill that out, 2 good resources are their public library, and they can help. If you have a child in school, the Family Resource Center could be a resource there. So actually 3. And then we are assisting people over the phone who would come for WIC appointments and things like that. So when they call for their WIC, we prompt them, have you done your census form yet, and give them some tips on how to complete that. So we'd be happy to help.
All right. Well, any closing thing that we didn't kind of touch on topic-wise or virus-wise today?
I don't think so.
I think we should stop with wash your hands.
Please.
Wash your hands and wear your mask, please.
Keep some distance.
And keep some distance. Yes, and this too shall pass.
Yes, so.
It seems like it's going on for a long time. For those who maybe are at risk and have decided to try to social distance at home for the most part, I know, and children as well, they're aggravated, frustrated, worn out with what we're doing here. But one of these days we'll be through this, and it'll be something we can tell our own kids about, hopefully. So.
Just gotta stay safe and stay sane.
Yes, yes, that's a good mantra.
Well, we just want to say thanks to Christy and Tira, and thanks to everyone out there watching. And hopefully within the next few weeks, we'll be bringing more exciting news from the Cumberland Valley District Health Department, some other programs that are offered, and we'll go into more detail on those and be more celebrant times. I think Christy said it best, and this too shall pass. So thanks a lot for tuning in with us today.